A new option in medical care is coming to Blaine this week. Capable of handling more severe injuries than an urgent care clinic, but substantially more affordable than an emergency room. It's called an urgency center, and it's relatively a new idea in healthcare. Danica has more.
The Blaine Medical Center has been home to several different medical specialties for years. They offer family medicine, pediatrics, OBGYN, eye care, diagnostic imaging, physical therapy, and more. This week they are adding even more with a brand new urgency center.
Emergency room typically is attached to a hospital and they're taking in trauma, like car accidents, that sort of thing, major chest pain, heart attacks, that sort of stuff. And then urgent care is typically a family practice doctor seeing cold, cough, flu, that kind of thing. And so what the urgency center is actually the space in between those.
It's a collaboration between Multicare Associates, the group who operates the center, and North Memorial Hospital, who will provide the doctors and nurses trained in ER triage. They say that Blaine was a natural spot for this type of care.
Multicare Associates, we've been in Blaine for 40 years. So we live here, so that's why we like it. But Blaine's a great target neighborhood for us just because it's 8 miles to Mercy Hospital, 6 miles to Unity, and then if you go up a little bit north of here is Cambridge. So there really isn't a hospital that close.
They are still putting the finishing touches on the place, but in a matter of days it will be open to the public. When complete, it will have 2 rooms that will be as equipped as rooms in the ER, capable of holding gurneys, and several other more standard examination rooms.
With the urgency center, we're adding the ability for the ED doctors, so emergency physicians from North Memorial, to come in. So now we can not just handle cold and flu and all that stuff, now we can handle the real traumas that are a little bit more out of the scope of family practice, but still not needing to go to a hospital.
For example,
if you have a major broken bone where it's like literally sticking out of your leg, we can handle that here. We can set it, we have the equipment to sedate you and put it all in, whereas typically in urgent care we wouldn't be able to do that.
While urgent care clinics are common, urgency centers are a pretty new concept that are gaining popularity among patients and doctors.
It is a pretty new idea. I'd say probably 3 years ago it kind of was introduced to the Twin Cities. There's a group over that did it in Woodbury, and so it's definitely new to the Blaine area. There's nothing around here that's like this.
One of the reasons places like this are becoming more common is that they are substantially cheaper than an ER visit.
It is a pretty new concept in healthcare in general, but it's taking off all over the country. I was actually just recently in Las Vegas and some other places, and they had this running. And partly because it's all about trying to control the cost of healthcare, because these kind of things keep the cost down, because it's, going to the hospital is expensive. So anything you can do that doesn't require the hospital stays, you should do outside the hospital, and that's part of why this concept's really taking a hold and is growing all over the country quickly.
For cost and insurance purposes, visiting the urgency center will have the same copays that you would see at urgent care, which for most people are dramatically lower than emergency room copays. You may be left with the question of when is the right time to go to urgent care, the urgency center, or the emergency room. But Matt says he thinks of it in very simple terms.
From a layman's terms, I think of it as, if I can drive myself to the hospital, I can drive myself here. But if I have to get picked up on the ambulance, then I'm too sick to come here.
And if you do visit the urgency center and they think your injury or illness is not severe enough to require the urgency center, they will send you down the hall to their urgent care facility. Or, if you are more severe than they can handle, they will get you transported to the hospital. For North Metro TV News, Danica Peterson reporting.
The new urgency center will be having an open house on Saturday, April 27th from 10 a.m. until 2 p.m. Visitors will get a sneak peek at the new facility, build their own first aid kit, and have a chance to see a North Memorial Air Care helicopter up close. The center officially opens on Monday, April 29th, and will be open from 10 a.m. to 10 p.m. 365 days a year.